and maybe you can share with them how what was it like to live with high astigmatism, and obviously your treatment was much more challenging, as we talked about. And how did you decide to come here? What's your experience?
Well, my vision was 2200. That's bad. I don't know if you know what line that is on the chart. That's the top line. I could read that. That's it. I had no idea that it was that bad. I really can't appreciate how bad I was until everybody started telling me how bad I was. You said I was 1 in 10,000. My wife always told me I was 1 in a million. But I think I'll disagree with you. When I was going through my exam, they were telling me how bad it was. And Dr. Wang said, no problem, I can do that. I get a lot of referrals. Here, I wrote a book about it. He gave me this textbook. I was like, okay, irregular astigmatism. Who uses this textbook? He said, everybody. It's the only one, the only textbook around. So 2200 was bad. I wore contacts and glasses, and none of them really worked. It was very frustrating. 20 years I wore contacts that didn't do the best for me. And so finally, I said, I'm going to get rid of these contacts and glasses, and did my homework, figured out that my most important sense is my eyes, and I want to go to the doctor that's got, I think you were the only one in Tennessee that worked on me anyway, but anyway, I didn't know that until I got here, but came to Dr. Wang because, it is my most important sense I have, and I'd pay anything to not have problems with my vision. And so that's how I got here. The procedure itself, I freak out. Anything that has to do with eyes, it just freaks me out. You don't give me enough value. I needed 3 or 4 of those. But anyway, it was a very, very easy procedure. And the hard part was not the procedure itself. It was the anticipation of it. But I was 2200 coming here the very next morning. It wasn't even 24 hours. I was 20/25 in my worst eye. And then my left eye was 20/15. And today I was 20/15. So both eyes 20/15. So I could read one of the last rows, which was amazing to me, having such a bad vision. But if you go through this, you're in good hands here. Do what they tell you to do post-op, because you'll have complications if you don't. So follow the instructions, do your medications in your eyes or drops. I still do drops. I'm off of medication now, but they really feel good, believe it or not. But anyway, that's my story. I really appreciate the good work you did.
Thank you.